Hello everyone. So today we are gonna learn newborn assessment or examination. The newborn assessment or examination is a procedure that is been conducted on the newborn baby after the baby's birth. Newborn examination. So the definition of the newborn examination is it is a systematic examination that is physical as well as the neurological examination or the condition has been checked on the newborn as the baby's after the baby's birth. Now the objectives. So for what conditions the procedure is so much important to the newborn baby after its birth or after coming to an external environment for the baby. So the objectives are to provide an assessment of the infant state of development of well-being. So first we need to check whether the baby is in a developing condition as to the external environment. Then next to detect any deviation from the normal condition. So whether the baby's condition is normal or not. To assess the progress of the baby. So the procedure is important in this three aspects, that is to check the development of the well-being, to check whether the baby's condition is normal or not, and to check the progress of the baby. Now indications. So in indication, first examination, a detailed one in labor room within 2 hours of the birth. So indications means when the procedure is being necessary to conduct on a newborn. So first examination is on the a detailed one in a labor room within 2 hours of the birth. So after the baby's birth, within 2 hours, this examination or this procedure is very important to conduct on the baby. Second, examination before the discharge. So before the discharge of the baby from the hospital, this procedure is very important to conduct on a baby. Third examination is after 6 to 8 weeks of the neonatal life. So after 6 to 8 weeks, this procedure is being conducted. Now terminologies. Now the terminologies that is basically used for the neonates life or the conditions. First is the small for gestational age, that is less than 10% of the weight at the time of the birth. 10% less than the expected normal weight of the baby as per the gestational age. So the gestational age is a term that is being described for a pregnancy, for how long the pregnancy is being going on what weeks the pregnancy is going on. Now, large for gestational age is more than 90% of weight at the time of the birth. So, as per the normal baby's expected weight, the baby's weight will be 90% more than the expected normal weight at the time of the birth. Now, appropriate for the gestational age is the basically normal condition in which the baby's weight is normal, that is 10 to 90% of the baby's weight. Now, full term. Full term means the weeks of the pregnancy that describes as the full term, preterm, and post term. Now, full term is 37 to 42 weeks of pregnancy is called full term pregnancy, that is 259 to 294 days. Now, preterm. The preterm term is given to a condition where the pregnancy weeks are 28 weeks and before the 37 weeks of gestational. Now post-term. The post-term is after 42, means that is more than 42 weeks. The normal condition is the full term where 37 to 42 weeks of gestational is been normal, but the preterm is when the baby gets out before the 42 weeks or before the full term is called preterm, and the post term is after the normal gestational period, it is 42 weeks, that is post-term condition. Now, the articles which has been required for the newborn assessment or the newborn examinations are as following, that is a tray containing hand washing articles, then an apron, stethoscope, inch tape, torch, bowl containing cotton whips, weighing machine, bowl with extra cotton, Macintosh, kidney tray, paper bag. Now, initial assessment of the newborn. So, this is the step of the procedure or the step of the initial assessment of the newborn. First step is identification. We have to check whether the baby is with a correct name, sex, and registration number, and identify the baby's gender, that is sex, for the verifying the records with the correct name and the registration numbers too. Second, gestational age. Gestational age, that is full term, preterm or postterm. We have to notify or clarify there that the baby is full term, preterm or postterm. Then vital signs. Check the vital signs in the following order. We have to get it into a following step, that is respiration, that should be between 40 to 60 breaths per minute. The heart rate, that should be 120 to 140 beats per minute, and the temperature between 36.5 to 37.5 degree Celsius. Now the whole physical examination to examine the baby's is being well after coming to the external environment. Now first we need to check the length. Crown to heel length with infant supine upside down with the knees slightly pressed down to obtain maximum leg extension. So from head to toe we have to check the length of the baby. Now head circumference, we have to check this head circumference, that is it has been measured with a tape measure drawn across the center of the forehead and the most prominent portion of the posterior head. So we have to measure the head with the prominent side of the head portion. Next, chest circumference. It is measured at the level of the nipples and is about 2 cm less than head circumference, 30 to 33 cm. So usually the baby's chest circumference is usually less than the head circumference, less than 2 centimeter less than head circumference. Now weight. Average birth weight is 2.5 to 3.5 kg.